We might actually be talking about two different things, but let's kind of get into it. So we're asking here if the end goal for acute pain patients and chronic pain patients is the same. So for example, what's the baseline pain? My pain's above the baseline. We're going to titrate up medications and do things that we possibly can to get the pain back down to this baseline. So let's talk about the difference between acute and chronic pain. So people suffering from acute pain is because of an insult to their body that's currently going on. So I smashed my foot with a hammer, or I got shot in the chest and I'm having lung pain. I had a surgery. I broke a bone. I've got a terrible skin infection. The goal with that pain right now, yes, in the short-term period of time is to try to function. I'm maximizing anti-inflammatories. I'm making sure the patient's getting a good night's rest. I'm ensuring that we're covering patients' anxieties, depressions. I'm making sure the patient feels heard. And then yes, beyond that, we're going to give opioids. But eventually that pain's going to go away as the patient heals. Chronic pain's a little bit different. Different patients have different causes for their chronic pain. Some experience things like allodynia, which is kind of like where the bed sheets really make your nerves go crazy. Some chronic pain is because of this long-term back pain. Even though the inflammation in your back is done, right, you're still experiencing the chronic pain because of a signaling pathway. Maybe you've been through it all. You've been through the surgeries. You've been through the nerve ablations. All of these things have been done. So you're saying, hey, if I'm on a chronic opioid, and it's not working as well, and my pain level's starting to become non-functional, why don't we titrate up on that opioid to where my pain's back down to a functional level? Well, that's actually maybe true. Maybe that is the goal. But you and a pain management specialist actually have to talk about the risk benefit and basically get into whether or not that the risk of giving you the medications and things like that is worth the benefit that you're going to get. Sometimes I've seen patients that really, they keep going up on their medications and they quit getting benefit. And that's really the hard place to be. That's why a lot of doctors often don't like dealing with the chronic pain piece. And that's the saddest thing in the world because we have patients that truly suffer. The biggest thing that we can do is try to educate ourselves and try to make sure that we are educating the doctors as well as the patients. I hope this is helpful. I certainly wouldn't want somebody with chronic pain to be on chronic Tylenol max dose, chronic ketorolac max dose, chronic ibuprofen max dose. That's all I'm saying. You wouldn't want to escalate chronic pain patients the same way that you'd escalate acute pain patients.